Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello, and welcome to another episode of Physicians Keepers. I'm so excited to have you here today. If you're watching on YouTube or you're listening on Spotify, thank you for tuning in, taking that time to listen to our conversation and get caught up on physician stories. If you're just joining Physicians Keepers for the first time, so here we highlight, physicians. We talk to physicians who have a story to tell, and every physician does, based on their experience. And today I have another amazing physician, Dr. Brittney Anderson, who's going to come in today and kind of tell us about her journey, and how she's thriving in private practice. So I'm just going to go ahead and read her bio. So Dr. Brittney Anderson is a board certified family medicine physician, founder of Anderson Family Care. That's an independent private practice in Alabama. She is a board chair of the Alabama Academy of Family Physicians and vice speaker of the National Medical Association of the State of Alabama. Through her podcast, Physicians Hanging a Shingle, and her coaching work, she helps physicians thoughtfully build private practices that align with their values, vision, and long-term goals. So thank you so much, Dr. Anderson.
Thanks, Dr. Ali. So good to be here with you today. So thanks for having me on.
Well, I mean, you have quite an interesting journey leading into private practice. So kind of, I'm just gonna have you just kind of walk us through the journey with that. Was private practice something you just kind of always knew you wanted to do, but how did you find yourself in this space?
Yeah, so I'm from Alabama where I practice now. And as a pre-med student, as a medical student, and even as a resident, the docs that I shadowed with, and well, maybe not as a resident, as a pre-med student, as a medical student, the docs that I shadowed in my hometown, Alabama, were private practice docs. One was my best friend's dad, one was a really good family friend, but they were in their own private practices. And as a pre-med student, as a med student, in my mind, that is what medicine was. It was family medicine. It was, you know all the patients, go to church with them, you eat dinner with them, and you are able to make those decisions. I mean, these were two male physicians. They would, close their office during, turkey season for a week and go out and hunt. It's Alabama. And that to me, the seeing the autonomy that they had, I mean, that's what sold me on wanting to be a physician. So then I go through my training, I get into residency, and that's why I went back and corrected myself because I did not get the opportunity to go hang out with those docs as a resident. I was in the hospital, I was doing all the things we do as residents,
Yeah.
and I wasn't getting that exposure to private practice. And I think that's one of the things, or one of the places that we really fail our residents is that they see the systems, they think that everything is hospital or big,
Yeah.
group practices, and they don't get the private practice experience, especially that, solo private practice experience, which is so important. So I did a family medicine residency in Alabama in Tuscaloosa, and it's a large family medicine residency, a 15, 15, 15, for each year residency program when I was there. And when I graduated, I did the same thing that all the other 14 residents did. I went into employment. So I went into employee practice. I started at an FQHC, or federally qualified health center. And I love the mission of it, the idea of wanting to, serve the underserved. It was wonderful, fantastic, but there were some administrative issues. In my clinic, it was me, my nurse, and a receptionist. And I'll tell
Yeah.
you, Dr. Alley, some days we didn't have a nurse. It was just me and the receptionist. Some days we didn't have a receptionist. It was just me and the nurse. Some
Oh,
days we didn't
wow.
have a nurse or a receptionist. And it was just me answering the phone, triaging patients, seeing the patients, drawing labs, all the things. And so, as
Yeah.
you can imagine, after a while, it was like, hands up, I cannot do this anymore. So I went then into academic medicine, actually went back to where I trained. And I still to this day, love teaching medical students, love teaching residents. But for anyone who's worked any period of time in academic medicine, you realize that even though you love the teaching, you've got to acclimate yourself to the
Yeah.
system, right?
Yeah.
The wanting, thinking something should change and wanting to change it, but you've got to go through, the
10
hierarchy.
layers. Yeah.
Exactly, right? And so for me, I loved practicing medicine, but seeing things that needed to change for me, things that needed to change for patients, things that needed to change for the staff around me, and not being able to make that change, it sucked my joy out of going to work every day. And so went through this, crazy stretch of what I truly believe was burnout. I think we sometimes throw that term around, but burnout is real. Like, girl, I was
It
burned
is
out. I
so
booked a
real.
flight. Yeah, I booked a flight to Honolulu. It was a round trip flight. I planned on coming back, but I booked a flight, was on the beach, toes in the sand, and got there and said, "This is it. Like, I cannot continue. If I look 20 years down the road, I don't see myself doing this, being able to do this and feel good about it."
Yeah.
On the beach in Honolulu, I wrote my letter of resignation. I wrote the beginning of a business plan for my private practice, got back on the plane, came back, gave my letter of resignation, and it has been all private practice since then.
Oh wow. Oh wow. That's quite an amazing journey. Now, you always, I mean, something that you talk about is that physicians, why we kind of wait till we get to that burnout stage before we decide that, okay, maybe I should do something different. And you kind of warn against that.
Yeah, absolutely. So I'm at this really cool space now that in addition to seeing patients, I am fortunate to be able to help docs start their own private practices. So I have this platform called Physicians Hanging a Shingle. It's a podcast, but it also is one-to-one coaching. So I'm able to do some one-to-one coaching with docs. And you're so right, Dr. Alley, that, I would say 100% of the docs that I'm working with now and have worked with come to me at the absolute level of burnout. And it is so much different, I think, when you're building a practice from a place of burnout as opposed to building a practice from a place of abundance, right? I think
Yeah.
just our mindset is different. We are in more of a like, this has to happen mode because I already gave my letter of resignation. Like, I got to make this work, as opposed to really being able to build from a safer space. So, one of the things that I love being able to do with this platform is start getting into the minds of docs early, right? To let them know that private practice is not dead. Private practice is absolutely possible, financially and just, mindset wise. So maybe this is something that you can start thinking about, during the good times. You don't have to
Yeah.
wait, you don't have to book a flight to Honolulu to decide that you are completely burned out and need to do something different. So it's been fun being able um, to to kind of dispel some of those myths that are out there, right? With docs
Yeah.
thinking that, private practice isn't, financially a good decision, or that, you need an MBA to start a practice, all these things that maybe we think, because again, we don't get that exposure in our training the way we should. I've even been able to go out and talk to some residency programs.
Yeah.
I'm amazed at how much the residents hang on to my words because again, they're not getting this in their training. And so it's been really fulfilling to be able to share with docs my experience and share with them some of the things that they should really be thinking about. Private practice isn't easy, but
Yeah.
it's not the hardest thing we've ever done.
That's awesome. Now, what are some of the biggest myths? I mean, you coach physicians regarding private practice and that decision. What are some of the biggest myths that you've heard about private practice?
Yeah.
Because sometimes you hear this where it's like you're not gonna have a life of your own, like you're gonna come back swamped to work. It's just easy to just go see patients, come back and allow someone else worry about the
Mhm.
back end, the hiring, the firing. Like, what are
Yeah,
some of those myths you've
absolutely.
encountered?
I think that's a big one. I think you've hit one of the biggest ones, and that is that we are not able to do this. We as physicians, that we are meant to be clinicians, we're not meant to be business owners, or that, we somehow can't be both. I think that is absolutely false. We survived organic chemistry, we survived the MCAT, we survived intern year. We've already proven that we can juggle more than one thing at a time, and we can do hard things. Now, again, I will tell anybody that I talk to, running a business, so being the owner and being the clinician in a practice will not be the easiest thing you've ever done because you have to find that balance. But I do think it absolutely is a myth that we as physicians don't make good business owners. I think it absolutely is a myth that you can't be financially successful and profitable in private practice. I am 3 years into private practice. We broke seven figures last year
Oh,
in our
wow.
practice, and will do well beyond that this year because I've completely changed my mindset and not just doing that to say, oh, we hit seven figures, but we're doing it and our practice is growing. We have, tons of great reviews from patients and we're practicing really good medicine. And so I think it absolutely is a myth to think that, private practice is not financially sustainable. You'll hear that. Docs will say that. We'll talk to docs who, will say that they were in private practice and then they went back to employment because
Yeah.
they were losing so much money. I would argue that those are the docs who, who didn't step back and say, all right, how can I make this financially work? Those were docs who maybe didn't make the math. They didn't sit
Yeah.
down and really think about, what their revenue needed to be, what their expenses were going to look like to make sure that the practice could be profitable. So I think that those are two of the biggest ones. And then the third, which I say all the time, is that, docs thinking that you have to have a business degree to start a private practice, which is absolutely not the case at all. I mean, look at where we are now with social media. We've got all these, people who are not physicians out here acting like they're physicians and, giving social media advice. If they can
Yes.
do
Social
that,
media docs. There are a lot of them.
exactly right. If they are bold enough to do that, I would encourage you to be bold enough to start a private practice without an MBA, but to do so with the help of, docs who have done it before. Mhm.
That's awesome. Now, for you, what was the biggest mindset shift that had to take place from employee to ownership? Like, what did that look like for you, Brittany?
So for me, it was the ability to run a team, right? The ability to run a team, because the truth is that I hold myself absolutely responsible for my nurses putting food on the table for their kids to eat,
Yeah.
right? And
Yeah.
so if I decide that, that, oh, it's fine if we just see three patients today, everybody can, have a good relaxing day, then I've said in my head that I'm feeding her children from my retirement plan, right? And so it is that ability to run a team and to start to manage a team when you have people who have different personalities, the ability to build a culture and to realize that that culture that you build, one, it relates to your staff or it is relayed to your staff, but it's also relayed to your patients and to build a culture that makes your practice somewhere people want to be, somewhere you want to be, somewhere your staff wants to be, somewhere patients want to be. And so I think for me, one of the biggest things was, you know, building a team and making sure that I and my team could create a culture where everyone thrives. And because everyone thrives, we don't have to, give ourselves a pep talk to walk into the clinic door because we hate going there every day. Our patients don't have to take a deep breath before they walk in because they don't know, what so and so's attitude is going to be like today. But I've had the ability to build a team and to build a team that works. Now, with that hiring, also comes the dehiring or the firing. And that is something that was very hard for me. But I've
Yeah.
taken on the mindset that if someone doesn't work well in my
Yeah.
practice, then I'm doing them a disservice by keeping them there. If they're unhappy coming every day, I'm doing myself a disservice if I feel like I have to tiptoe around them. And I'm doing my patients a disservice by keeping them there because at the end of the day, I'm running a business. And in that business, while we care about, people, we care about the health of people, we care about the health of the staff, that business has to be sustainable. And so I'm really working around that, building a team and making sure that team works is one of the huge mindset blocks that I had to get past.
It seems you've done a pretty amazing job with it right now, because like I said, you're expanding. You won an award recently. So sounds like, that's a really great place to work. And so you are pretty much an example of what it is to say, hey, this can absolutely work. If you are able to overcome those mindset barriers, those misconceptions that have been, grilled to you, um, it can work. And thank you so much for being a great example. Now, one of the other things that physicians worry about is a time factor, where they
Yeah.
think if you have a private practice, like you pretty much will have no life. You're just drowned in work, coming back. Now, what does your work life and home life look like? Are you consumed with work every single day? I mean, do you have downtime, or tell us what that's like for you?
Yeah. So you know this. We were talking about it just before we started recording. So I love a good, project, which is maybe why I started private practice. But I love things going on. But in the town that I live in, our downtown area has been really kind of abandoned for,
Yeah.
decades. There are all these buildings that are there that are just, there for the who wants to buy it and do something with it. And so when you ask the question of, do I lock myself down into private practice and is my practice, what consumes me? My very quick answer is no. Allie, I just bought 6 buildings in downtown Demopolis. I'm renovating them all. And when I say renovating them all, like I'm there every day, like feet inside, hands on things,
Oh,
meeting with
wow.
contractors, meeting with the architects, because I'm so excited about these buildings and what they can become. But the reason that I'm able to do that in the other things I do, you mentioned I'm the immediate past president and current chair of our Alabama Academy of Family Physicians. I'm the vice speaker for our state medical association. And so I'm at those meetings, I'm advocating in the state, and I'm able to do all those things that I really like to do, the coaching docs included, because I've made private practice work for me, right? I've made it work for me. I've built in the time that I see patients. I've built in the time that I run my practice. I call my CEO time. So I don't see patients at all on Thursday, all day Thursday. I work on my practice. I look at our patient numbers. I look at our billing, collections. I meet with our billers. I meet with members of my staff. And then on Wednesday afternoons, I don't see patients. That is the time that I, go do the things that I want to do. I make my doctor's appointments. I go get a massage. I do those things, but I'm able to do those things because again, I built a team around me that works. I have a physician assistant that I hired about a year ago, and so she absolutely, is a huge part of our staff, and we work collaboratively. So she doesn't have her own panel of patients. We share my patients, but we've been so busy that I've also hired another physician to come into the
Oh,
practice.
wow.
So I built the practice in a way that allows me to not be bogged down. I put systems in place. We are probably the most efficient practice around. We huddle every morning so my team knows this is what's coming in this day. Yes, we'll have some walk ins, some same day appointments, but if we look at our schedule in the morning, we know what that schedule is going to look like. So my nurse knows, who needs their mammograms and, colonoscopies. My lab tech knows at the beginning of the day what lab she's drawing for those patients who are coming in. So we're able to be efficient. I'm not having to go in and out of rooms. I'm able to get my notes done efficiently so that when I leave my office at the end of the day, I leave it there. I don't bring my work computer home. Yes, I can pull it up on my MacBook that's here at my house. But as far as lugging this is my work computer and I have to drag it everywhere I go, I don't do it. I put systems in place so that we can be efficient because there is more to life. I love practicing medicine, but there is more to life than practicing medicine every day, all day. And I'm here to go find those things and see what they are. And so I think the real beauty of private practice is that I can turn it into what I want. I tell the
Yeah.
docs I work with, I'm not a morning person. I don't want to see a patient before 9 o'clock in the morning. I do not want to do it. And private practice allows that. And so I think when you build a practice the right way and you build it in a way that allows you to also be able to do the things you like to do, that's what makes it sustainable. And you just can't make those decisions sometimes in employment.
Oh, wow. That's so great to hear, Dr. Anderson. Now, was this all just a seamless transition for you when you were learning, or were there some mistakes you made? I mean, how did you just even, so if someone wanted to start, how do they even approach the whole framework of it? Did you go in kind of knowing what needed to be in place, or were there some hits and misses that made you like, oh, maybe I should have done this from the start?
Yeah, there were some absolute hits and misses, right? Which is why I think now I'm in like this perfect position to be able to tell docs, like, don't do this. I did this. This is a waste of your time. But then there are also some makes, right? There were some things as far as the marketing that I was just making up on my, living room floor on a, Wednesday, random Wednesday evening, things that really, really worked. And so, I think the marketing for my practice really worked well and brought in just, a boo koodles of patients who were ready on day one. So, folks, I didn't slow walk into it. We didn't have a half schedule on day one. We went in with a full schedule, but it was
Mm,
because my marketing plan really worked. There were certainly places where, I would certainly caution docs not to make the same mistakes that I made as far as, finding the space and making sure that you're leasing a space that actually works for you. So, I got really excited on the front end, went into a lease with the space, over trusted the landlord, and it just didn't work out. So here we were, not even a year into the practice. I've got an attorney trying to get out of this lease. We're trying to
uh,
build another, clinic
location.
that
Yeah.
works for us. Yeah. And so there are things like that that now on this side of it, I can tell docs, make sure you're doing this, this, and this, because I didn't do those things. And those things, set me back, if not financially, just mentally, right? Kind of put me in a
Yeah.
bad headspace when I'm also trying to see patients and run a practice. And so there were absolutely some misses, but also some makes. But I tell folks on this side of it, one of the things I really wish I'd done was to lean on docs who are already in private practice and say, hey, I'm thinking about doing this. What do you think? Because now on the other side of that, I've got a great group of friends who are in private practice who, if I'd gone to them before, they would have said, Brittany, that's a bad idea. Or, oh, Brittany, yes, I do this way. Why don't you think about it? So a lot of things I kind of figured out myself along the way, when I should have leaned on a little bit more help from the beginning. And I'm new to coaching and all of these things, and now I'm in a space where I realize how important it is to have someone that you can bounce things off of, and just in general how important it is to be in a group of people who are like-minded, to find that other physicians that you can talk to about the business of medicine. I just think that's really important. But yes, there were some absolute misses, but also some really good makes and hits along the way as well.
Thank you for sharing that for that journey with us. And it's just kind of like you said, there's nothing new under the sun. It's a saying about that, right? So there's always whatever you want to do. Someone has done it, is doing it well, doing it right. And so if you want to embark on it, then you don't just want to just take a chance. Like ask questions, find the right people, those who are thriving, and that way you start on a firmer foundation, right? You don't have to learn through your own experience. Like they would tell you their experience, and you can learn from that. So thank you for sharing that with us. Now, what would you say to what are the signs that someone should start considering, like what signs would someone have internally that will make them think, okay, strategically, maybe I should start considering ownership?
Yeah. I think if you get to the space kind of where I was again thinking that, gosh, so I got to a space of thinking that, gosh, I wish that I could change this. I wish I could change that. And so when you're wishing you can change more things than feel like need to stay the same, then maybe those are things that you need to think about. How can I create something that allows me to make these decisions myself, right? Or even more when you get to a space where you are driving down the road and you're thinking, gosh, if I had my own private practice, sorry, gosh, if I had my own private practice, I would do this, this way instead, or I would, consider this, or I would hire this person, or I would, do XYZ. When those thoughts get to where they consume you more than the thoughts of going into someone else's job, that's when maybe you sit back and start thinking, is this something that I really can do or should do. I think it's also important to really lock in kind of financially where you are. I mean, it's a big commitment. If you are
Yeah.
bogged down with, student loans, or you're overwhelmed with credit card debt, all these other things, maybe you're starting a private practice now isn't the time to think about that. Maybe you step back and get those things in order before you start thinking about it. But if you have yourself at a good kind of financial space where you can do it, if you are at a place where you have more thoughts about it, or it starts to kind of overtake your thoughts, that's when I say sit down and really put things on paper. One of the things I tell the residents, I take them a little worksheet and I say, if you were going to start a private practice, what would it look like? Where would you want the practice to be? What services would you offer? What days would you work? What would your schedule look like? What staff would you hire? If you can sit down in one setting and just start rattling those things off, then you probably are thinking more about private practice than you think. And I think that that's when you really slow down and start to say, all right, how can I do this? Who do I want to serve? Where do I want to serve them? What do I want this to look like? And what do I want to get out of practicing medicine?
Oh, thank you so much for that. I mean, that's such a important direction when it comes to strategically thinking about it. And I think you do have a tool. I think that you share, and we'll put it in the show notes for physicians. Tell us about that tool.
Yeah, so I have a quiz. So a quiz that's called "Is Private Practice Right for Me Right Now?" And it goes through kind of some of the things we've been talking about. And I think it's really good to help docs who are on the fence, who are thinking, am I at a space where I should be, considering private practice? Or do I need to slow down and think about some things before then? And so I would love if anyone is interested, they can take that quiz. Another thing that I had to share, I'm going to reach over because I've not done a wonderful job of publicizing this yet, but I wrote a book
Oh,
called Private
wow.
Practice on Purpose. And it is just that. It's for that doc who, is having these thoughts of, do I want to consider a private practice? Is private practice right for me? And if so, what are those first couple steps I need to take? And it's the book that I wish had been there when I was starting my own private practice, right? It talks through all the things, especially the mindset, but then talks through, things you should think about when you're choosing an EHR, when you're hiring staff, when you're thinking about the finances. And so I think that those are really good places to start. But I'm really happy about the book. This copy that I just held up is literally the proof of it. And so it will be live on Amazon by the time this airs, and I'm excited about it.
That is awesome. And I think I did put in, I mean, yes, if I remember correctly, you advertised your book on Facebook
Yeah.
and I did go, I think, yeah, so it's not ready, the print
Yeah.
version.
It's there. Yes, no, it is there and it is available. So when this
Oh,
airs, it will be ready to go. Yep.
awesome. I would definitely put this in the show notes. So thank you. For anyone who is thinking about private practice, trust me, you want to get your hands on this book. It is an absolute must. So that way you can kind of get the mindset behind it. And I promise you that it is money that will be well spent before you go down spending
It's
hundreds of
right.
thousands.
Spend the few dollars before really committing to things that really cost money.
Yes, spend those few dollars. Now, for you, what would you say, growth wise, personal growth wise for you has been since you made the transition to private practice? Like, how do you see yourself from when you were an employed physician to now, the growth that's taking place now that you are in your own space, leading your own team? What does that look like, feel like for you?
Yeah, I've seen a big change in my ability to make decisions, right? So to make decisions and then to just be confident and comfortable in those decisions I make. And that comes from autonomy, right? The autonomy that comes with private practice. My staff has a staff meeting every week, Wednesday at 12 o'clock. We all sit down together. We talk through the things that we need to go through. And what my staff and I realize is that we can say at 12:30, something needs to change in our practice. And when we open the doors back at 1 o'clock, that change goes into effect, right? And
Mm.
I'm able to see in real time either this was a really good idea or this was a really bad idea. But what I found is that thankfully, by God's grace, most of those ideas have been good ones. Now, there have been some really bad ones too, but the beauty again of private practice is that you can look back and say, you know what, that was a bad idea. Let's change this and let's go back to, what we were doing before, or let's shift that again. And Allie, that has really carried over into my life as a whole, right? So instead of being, the person who I was before who would, want to make a decision but not be sure how it would turn out, and so I'd, would hold back on it. I'm not that person anymore because in practice, I make those decisions and I realize this is either going to show that it was good or it was going to show that it was bad. But either way, I'm in absolute control of making it work, right? Of pivoting it, of pivoting from it. And so I do that in life now in general, whether it's, deciding what I'm going to eat for dinner or deciding if I'm going to buy 6 buildings downtown. I realize now that I can make a decision. I can live with that decision because it's my decision to make.
Yeah.
And it is a crazy feeling to have that amount of autonomy and to be able to sit in the decisions that I make, right? That
Yeah. Yeah.
the decisions that I make. And so I love the person that I'm becoming, and I'm not there yet. I'm still working on it, but the person that I'm becoming who is now much more confident in my ability to make decisions.
That is amazing. I mean, that you're able to have that mindset shift because, even though as physicians, we lead teams, right? We do that but for some reason, there's that mental block where we don't see ourselves as the decision makers, right? We just say, okay, well, whatever is done, I'll just roll with it, and we never assume that role where, well, I can make decisions, and so, I mean, something can change based on the decision I make, so I guess just where you are right now gives you the ability to grow in that aspect. And I'm sure that, like I said, like you said, it's spilled out in every aspect of your life. So that's amazing what, that private practice ownership has done for you. Now, you said you're in a small town, you practice in a small town. Um, do patients come knocking on your doors or to stop you at, like, is that
Literally,
a thing that
I'm
happens?
at the point where I walk through the grocery store with my AirPods in my ears, right? There'll be nothing, the AirPods will be dead. There will be nothing coming through the AirPods, but I'll see somebody and I'm just like, and I keep going because it's a small town. And I've learned that even when I see people, I've gone from saying, "How are you doing?" to, "Hey, it's nice to see you." Because when you say, "How are you doing?" and they're your patient, you get the, "Oh, well, I got this, and this." I'm like, that's not what I meant. Like it was a casual, you weren't even supposed to say anything back. So that does happen. But the other thing that happens that I love even more than that, so like, everyone in town knows where I live. I've not had anyone knock on my door for medical issues, but I'll sit out on my porch in the morning, drinking a cup of coffee. And depending on, where people live and where they're going, there's a school nearby. And so it's every morning that I'm out there. People will drive by, they'll throw their hand out of the window, wave at me. Parents will pull over, their kids will hop out of the car and come give me a hug before they go to school in the morning. And those things I love. Like,
Yeah.
I love those things. And so that's been really fun. But it is that balance. It's that balance of boundaries, right? Because I am running a practice. I'm in a town where most people know me in town. I want people to feel like I'm approachable, but not like they can come knock on my door and ask me to, prescribe them a medicine, right? And
Yeah.
so it is creating those boundaries. And I do that by when you come in to practice that first visit that you have with me, I set those boundaries from the beginning, right? That, it's, this is how my practice runs, the clinic policies they sign. If you need something after hours, we've got an after hours phone line, call them, because otherwise, I think that what can happen in private practice is that you can feel so much like, I'm worried about word of mouth, or I
Yeah.
need people to, think that I'm a, happy person all the time. And you find yourself giving in because you don't want people to say bad things and then it sabotage your practice. But I am fortunate that I've worked on, I'm still having to work on it, but kind of drawing that hard line. But it's been a work in progress and something that I do really encourage docs to do from the beginning, right? And patients will respect that. Patients, I mean, they don't go to the banker when they're out at the bank and ask them, out at the baseball field and ask them to
Yeah.
borrow money, like, and so it is setting those boundaries, and that is so important.
It truly is, like I said, I think because, when you're working for like a set of system, right? If there's a bad reviews, it affects the system. Like if I'm working for like a big corporation, but then when it's your name behind the practice,
Name.
you know, you want to, always you have a tendency to want to just please people. And in that sense, if you don't set the boundaries, then you get exhausted and you don't get paid for it.
That's the thing. And what I have started to say, and I will say it to folks, is that, I'm in private practice now. I have to really be mindful about like liability and my malpractice insurance. It's Miss Jones, do you want me to lose my license because I'm prescribing you a medicine in the middle of Walmart? And I mean, it's things like that that I will say to Miss Jones and patient, oh
Yeah.
no, Dr. Anderson, we don't need you to get in trouble. You take care of our whole family, that kind of thing. And so I put so much of it on, I'm responsible for paying my own malpractice insurance. I'm not a part of a big group. If something were to go bad, these people would shut me down.
Yeah.
And that works well sometimes. But the AirPods in my ears works even better. And I just throw my hand up and keep going so I can get out of the grocery store.
Well, thank you so much for that tip. So, for those of us who are Android owners, we probably need to think about what we need
That's your first mistake there. Get it? Go Apple.
to enjoy forever. Well, thank you. I mean, it's been amazing hearing your conversation today. But for someone who is listening, who's curious but unsure, feels stuck, but hasn't considered ownership as an option, what would you say to them?
I'd say put it on the table, right? And whether you decide private practice is right for you or not, put it on the table. And so if you are at a space where you're thinking about leaving one job, and you're on the hunt for something else, slide private practice as an option there. Private practice is not dead. I will shout it from the rooftops forever. It is a viable option, but it is not easy either, right? It's hard, but it's a different kind of hard. It's your own hard. It is a hard that you are choosing in order to be able to build something that is your own. So, that's what I ask people. Put it on the table, continue to listen to podcasts like yours, podcasts like mine, talk to docs who are in private practice, do those things. Take the quiz that you mentioned earlier. Do those things to see if it really is something that you're interested in. Private practice isn't for everybody, but it is for more of us than who realize it because I think so many of us just don't even put it on the table as an option.
Oh, thank you so much. So if someone wants to find you, I'm definitely going to put in the links from a coaching standpoint, like just kind of give all the things you do for physicians in private practice to aid them.
Okay, yeah. So everything can be found at my website. So the website is hangingashingle.com. The link to the book isn't there yet, but the book is available on Amazon and it's called Private Practice on Purpose. But the other things are there, the options for one-to-one coaching. So I have a 10 session framework that it is proven, it's true, it works with docs who need it. And so we do that, but I also have a 6 session coaching that really is, either for docs who say, I just have a question about this. Can we work around this thing for 6 sessions? Or what lately has been is docs who are already in private practice who say, all right, Brittany, I've heard what you're doing in your practice. I need to really revamp some things. I don't need session one is about this, session two is about this. Can we focus on this thing for 6 sessions? And so I do that. And then there's some docs who say, I just need to work on this one thing. I don't need 6 sessions. Can we do, a 90-minute call that we are just hammering down on how to hire an office manager for my practice? And so I have those things. I have the quiz that you mentioned and a digital course that's called Plan to Practice. And you can get to it by going to hangingashingle.com/PTP, like plan to practice. And it's for docs who are trying to think through the very early process, the working the business plan, to have something not just to take to the bank, but also something to solidify in their head. Hey, this can actually work. Like I have enjoyed doing this and I can, build a private practice that will work. So all those things again can be found at hangingashingle.com. And thank you again so much for just the platform, the opportunity to allow me to say that. The podcast is available. It's called Physicians Hanging a Shingle, Instagram, Facebook, all the places. I'm there.
Well, thank you. And we would definitely put in all those links in the show notes. And if you are a physician and you've been kind of on the fence, I mean, you look at everything that's at your fingertips right now, that Dr. Anderson, who, I mean, you can she's doing amazing at her private practice. How many staff do you even have right now?
So right now there are eight of us. So there are eight of us, and we are the most efficient eight people that you will ever meet because we all come to work for a purpose. We all, want to get home at the end of the day to our families, and so we do what we need to do while we're there. We do right by people. We take good care of our patients, and we like each other.
That's important. You all like each other. Very
Yes.
important. And like I said, so you've been an amazing physician's keeper today, Dr. Anderson. Thank you for showing up, for showing physicians that light, if private practice is something you've considered and you've had all these misconceptions, you've had all these doubts, you've had all these questions that just were just hanging. These are so valuable resources and information. You're seeing someone who's living out the dream, who's not just, I mean, look, she just told you she just bought six buildings. I mean, she has a life outside of medicine, and she's thriving even with private practice. So it is doable. Dr. Anderson, thank you. It's been awesome having you here today. And if you are a physician and you have a story to tell, you have something that can help another physician to grow, to, get through whatever they're dealing with, to make decisions, let me know. We're open to having those discussions. You can send me an email at drremler@gmail.com. Follow us on Instagram at Physicians Keepers. And we would just be glad to hear the stories for you showing up for another physician and telling them, hey, if I did this, you absolutely can do it. So you get an awesome Physicians Keeper badge, Dr. Anderson. We appreciate having you here today. Thank you so much.
Thank you so much. Thank you for all the work that you do for the podcast and everything that you put out in support of docs. Dr. Alley, it has been a pleasure to be here with you today.
Appreciate it. Thank you so much. Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.